Hello, everybody. Welcome to Ask Dr. Bob. My name is Dr. Bob Gabbay, and I'm the Chief Scientific and Medical Officer at the American Diabetes Association. And you have tuned in to Ask Dr. Bob, and that's where you get to ask me questions about diabetes. And so this month, we have a lot of questions. And the questions revolve around two things that we are recognizing this month. This month is Limb Loss Awareness Month and Minority Health Month. And so, what we'll do on this session is divide our questions half and half roughly. So, we'll start by taking a number of questions that you have around limb loss awareness, and then we'll move to the Minority Health Month recognition and questions that go with that. So, thank you all for sending questions. We have a lot of them, as I said, so I'll just jump right in. But you will have an opportunity on the chat to type in any other questions you may have. And if we have time, would love to get to them. So, in thinking about limb loss awareness, the first question is, does diabetes lead to limb amputations? Um, and sadly, the answer is yes. Unfortunately, it can. And in fact, diabetes is the leading cause for non-traumatic amputations. So it is a very big problem. And that's why we are thinking about that this month more than ever, but it's something we should always be thinking about. And so the next question is a very logical one. What causes amputations in people with diabetes? And typically it's one of two things or a combination of those two things. And so what are they? The first is nerve damage, neuropathy. Um, People with diabetes over time, if they have high blood sugars, the high blood sugars damage the nerves. And what ends up happening is they start to lose the ability to feel things, and their feet are one of the early places that this happens. Sometimes they can feel numbness or burning or pain, but they don't have normal sensation. And because of that, they can have little injuries to their foot and not know it, and then continue to walk on that. And as a result, the skin can break down and they can get an ulcer. Once they have an ulcer, now they have a risk for infection because the ulcer is a break in the skin. Bacteria can get in. That can lead to infection. And once one has an infection, depending on how early you catch it, sadly, sometimes that leads to amputation. So that's one cause, nerve damage. The other cause is peripheral arterial disease is what it's called. And basically, it's the arteries, the blood flow to the legs and the feet um, get worse over time in some people with diabetes. And so there's not enough blood flow to the feet. And as a result, the feet cannot heal as well if they have any kind of injury. Um, and again, that injury can lead to infection and ultimately, if untreated, the potential for amputation. Some people have both the nerve damage and the blood vessel problem, the blood flow problem, makes it even more likely. Who gets that blood vessel sort of blood flow thing? Well, it's people with diabetes that, again, uh, don't have good control of their blood sugars. Um, Having high blood pressure makes it more likely, and so treating blood pressure is really important. And one other really important thing that raises the risk, and that's smoking. And so, uh, anyone you know who smokes, it's worth them trying to stop. And there's lots of resources out there to help people quit. We know it's not easy, but it's worth paying attention to. So that's why people with diabetes at risk for developing amputations. It's blood flow problems and nerve problems. So the next is, what's the likelihood of that happening? So turns out, as I said, diabetes is a leading cause for amputation, and the rate of amputations in the US has actually grown by 50% over the last several years. So it's getting to be a bigger and bigger problem, all the more reason why we at the American Diabetes Association have been partnering with other organizations to really try to address this issue and prevent amputations. The other thing that really has gotten our attention, and most people don't realize, is there are significant inequities, as there are in diabetes in general, but particularly amputations. And an example of that is Black Americans are 3 times more likely to have an amputation than whites. 3 times more likely to have an amputation. Terrible. We have to do better. And so we'll talk about that in a moment, what you can do to prevent it. And the next question is, are amputations more likely in people with type 1 diabetes versus type 2? Remember, type 2 is what 90% of people have. Type 1 is about 10% of Americans. Um, it both groups of people are at risk for amputations through the same ways that I described, the nerve damage and the blood flow problem. People with type 2 diabetes tend to be older. They may be more likely to smoke. They may be more likely to have high blood pressure. Those things increase the risk of the vascular problems. And so they're somewhat more at risk, but both people with type 1 and type 2 need to watch out for this. And so a great next question that somebody asks are, what early signs should I look out for when it comes to limb loss? Well, one of the most important things, and it sounds simple, is look at your feet. Look at your feet every day. And if you can't see the bottom of your foot, which some of us can, um, use a little handheld mirror and look at the bottom of your foot, or use your phone and take a picture of the bottom of your foot. Um, what you're looking for are calluses, and even more importantly, any kind of ulcer or break in the skin. If you catch these things early, you can prevent all of the problems I described, and the possibility of limb loss. So it's really important to look early, and be able to see any early lesions that might exist, and then bring them to the attention of your healthcare provider. So here's another question. Why do people with diabetes legs turn black? Well, first of all, that's very rare, but sometimes what that black color can be is something called gangrene. And you may have heard of this from like stories in the war and things like that. Gangrene is basically when there isn't blood flow to the tissue and it dies, and it's sort of dead tissue. And dead tissue, unfortunately, can easily get infected as well. So when one sees that black color, and that's really a very advanced stage of that blood flow problem, that is really important to bring to your provider's attention, because that means you're at really high risk for potential amputation. The good news is, even then, even at that late stage, there are things that can be done to help protect and potentially avoid amputations. So another viewer says, what types of questions should I be asking my doctor about limb loss or amputations? Well, first of all, let me start with the most advanced situation where people are told you need an amputation. Uh, my suggestion is it's always worth getting a second opinion, because there are new treatments available now that many times, vascular treatments to change the blood flow to the feet and the leg, that may prevent the need for an amputation. So get a second opinion. Go to a wound center that specializes in this kind of thing, and many times you can prevent the amputation. So that's probably the biggest you know, thing to think about. Now, the next question says, what are some things I can do to limit the risk of getting an amputation? Well, we want to make sure we avoid this altogether. Well, I mentioned looking at your feet, and early on, if you see something, tell somebody, and tell your healthcare provider. For the people that have that nerve damage that I mentioned, you know, we said that limb loss is a combination often of nerve damage and blood flow problems. For the people that have that nerve damage, they probably should be seeing a podiatrist, a foot specialist, on a regular basis to be able to check their feet, uh, to maybe think about special fitting shoes because, again, they can't feel their feet normally. So, normally if we put uncomfortable shoes on, we would tell it's uncomfortable and we wouldn't wear them anymore, or usually. But people that have this nerve damage can't tell that the shoes are uncomfortable, and the shoes could be damaging their foot and causing an ulcer. So, podiatrists can help not only with special shoes, but also trimming nails. So often, when you can't feel your feet, you may trim it wrong and by mistake damage the tissue, cut yourself. And because you don't feel it, these people that have the nerve damage don't feel it, that can lead to all sorts of problems. And so people that have the nerve damage in general should be seeing a podiatrist. So check your feet, see a podiatrist, ask your healthcare provider if you should be seeing a podiatrist. They can test whether you have sensation in your foot. And some of you may have had this done. There's a little wire that they just push against your foot to see if you can feel the pressure of that wire. It doesn't hurt, uh, but if you can't feel that touching you, you're probably at risk for having a foot ulcer, and you probably should be seeing a podiatrist. Okay, that was a lot of questions about a potential limb loss, and we do have the audience asking a question. No, I think we're good. I think we're good. I think we covered them. So thank you, everyone. We're going to move to our next section. So in addition, this month, it is also Minority Health Month. And when we think about minority health, diabetes really is up there in terms of the challenges. More likely to have diabetes, more likely to do worse. I mentioned some of those statistics about amputation. Black Americans 3 times more likely to develop amputations. So we have a number of questions that relate to minority health, and let me move to those. So first question is, how much more common is diabetes in the minority community? And it is significantly more common. Americans of color are nearly twice as likely to develop diabetes. Uh, and in some populations, that risk is even higher. What we're seeing around the world is increasing numbers of people with diabetes. And for example, in the Middle East, in a number of Middle Eastern countries, a quarter of the people have diabetes, which is really a high number. So the next question is, why is that? Is it mostly genetic? Well, there is some genetic part of this, but poverty really plays in. So let me share a couple of statistics. First of all, we know that people that live below the federal poverty line, poverty level, are double the risk of having diabetes and of dying from diabetes. And if you look at those individuals that are below the poverty level, 3/4 of them are people of color. So poverty is a big driver as to why the risk of diabetes is so much higher in many communities. There certainly are uh, genetic factors, uh, genes that probably helped us in the days when food was scarce, which is sort of most of human history, that allowed people to store food really well. And now that same genetics unfortunately makes them more likely to become obese, more likely to develop diabetes. So this is an area addressing the inequities in diabetes that the American Diabetes Association is really focused on. And I encourage you to go to our website and you'll see information about Health Equity Now. It is a strong stand that the American Diabetes Association is leading with many partners, and it starts with a Bill of Rights. And I encourage you to look at those 10 Bill of Rights, and they're things like everybody should have access to healthy food. Everybody should have access to the right treatments that can help prevent these complications of diabetes. So, again, go to the website Health Equity Now and learn more. So the next question is, what type of diabetes is more prevalent, more common in minority groups? And it's largely type 2 diabetes. So this story that I'm telling you is really about type 2. Uh, and remember, type 2 diabetes is the more common form of diabetes, and it's related to being overweight, sedentary lifestyle, those kinds of risk factors. Um, so then the next question is, as a minority, what are some of the diabetes symptoms I should look for? Well, the symptoms for diabetes are the same whether you're a part of a minority group or not, but let's review those. It is excessive thirst, excessive urination, can have blurry vision. Um, Women may notice that they're developing fungal infections more commonly. But maybe the most important thing to keep in mind is for type 2 diabetes, most people have no symptoms. And so you can't depend on symptoms. And so, how would you know if you have diabetes? Simple blood test. Your healthcare provider can do this. You should be screened for whether you have diabetes or not, and they can tell you right off the bat whether you do, and then do all the good things that can help prevent any of these complications, including, as we talked about, limb loss. So another person asks, as a minority, should I ask different questions related to my diabetes during my doctor's visit? It's a good question. I think largely the questions are the same, but I think one thing that is important that and I can tell you, I take care of a number of people with diabetes. I continue to do so, and what's really important for people is to prepare for your visit. So, because the visits in your provider's office or virtually are usually probably short and a little bit rushed. That's the way healthcare a lot of times is, um, and so it's important for you to prepare by writing down the questions you want to ask to make sure that in the heat of the moment you ask those questions. And so, you know, how am I doing in terms of my diabetes? How could I do better? Those are good questions. And then any issues that are important to you or that you're concerned about, write them down so that you can bring them up when you meet with your healthcare provider. So another person is concerned about the next generation, and they ask, how early should I monitor and manage my child's nutrition and lifestyle habits to prevent or delay the development of diabetes? Well, I think in general, we want to establish healthy habits as early as possible. So, what do I mean by that? Well, early on, getting getting kids used to eating fruits and vegetables. I know it's not always easy. Pick your battles, find some good foods that they might like. They model after what you do. Um, but getting them eating healthier foods, uh, it's never too young to think about that. Of course, infants are a different story, and one needs to introduce foods at the right level. The other important part of a healthy lifestyle is physical activity, and that's something you really want to encourage in your children. They should be active at least 60 minutes a day. And one challenge we all have today is with technology, the amount of screen time. And we know the more screen time kids have, the more likely they are to have obesity. And so, getting kids to be physically active and getting them into that as a natural part of their life is important. And where do you think they learn that from? From you. So you being active is the best predictor as to whether they'll be active. And being active is good for all of us. So let's model the right behavior for our kids. The next question says, again, one of our minority viewers says, as a minority, access to care is vital. Is there a way I can push for access to care for me and my family? That's really, an area that really concerns us at the American Diabetes Association, is that people don't have the access to the care that they should. And in fact, in those Bill of Rights that I described in Health Equity Now, that is one of those things that we are advocating for. I think a couple of things that you can do. One starts with knowledge. Empower yourself with knowledge. Where do you get knowledge about diabetes? Uh, the American Diabetes Association website, diabetes.org, has a ton of information, and it's all been looked at and vetted by our experts, so you know it's reliable information. As we know, reading anything on the internet can not always be accurate. So go to a trusted site like diabetes.org to learn more. So empower yourself with knowledge, and then prepare yourself for your visit with your provider and advocate. Do I need to see some kind of specialist? Why? What? How are my blood sugars doing? And what's my goal? How's my blood pressure doing? And what's my goal? How's my cholesterol doing? And what's my goal? Those three things, the A1C, B for blood pressure, and C for cholesterol. If you can manage those three things to do well, you can prevent most of the complications of diabetes. And so be your own advocate. I think that is really an important part of this. Um, So I want to thank you all for joining us today. We're running out of time, and we've gone through a lot of questions. We've spent time talking about Limb Loss Awareness Month and a number of questions about how to prevent limb loss. And we then shifted into the other thing that's happening this month, and that's minority health. Again, the diabetes.org website has a wealth of information. I'm Dr. Bob Gabbay. This has been Ask Dr. Bob. Tell your friends, and I look forward to seeing you next time. Be well.